the key kind of issues that young people are facing, which has kind of been aggravated by COVID, is the transition between children and adult services. And I guess particularly with that, a lot of young people, especially during the pandemic, have kind of been told on their 18th birthday, support is ending now. I know to a lot of young people that we've spoken to, it just feels frustrating that is the way that things are.
I mean, one of the main things that we've been focusing on in Lancashire has been the isolation. We've had a lot of things about the isolation and stuff, because we're already isolated as it is, and then being put into a lockdown and things, and still carrying on into going out of a lockdown back into a new lockdown. Mental health is a big thing. And I think people have started to sympathise, young people. I think they've started to sympathise with young people and students a little bit more, because they obviously were the people that are raising these issues. So
support from the foundation was hugely well timed for us and allowing us to deal with the initial rise in demand that we had. So when we went into lockdown, we saw a lot more rise in young people contacting us around domestic violence, where they had family relationships which they were struggling with, or relationships in the home which they were struggling with. Lots of academic concerns, lots of loneliness was a really big factor that kept coming through. Young people feeling completely disconnected from other young people, and the difficulties of that, all of it driving poor mental health.
So, I mean, you talked about being almost surprised that, not having that face-to-face actually is really affecting you, whereas you thought social media might be enough, previously. Can you just talk about that a little bit and the impact it's had?
Having been publicly open about my mental health, people around me do start to talk about it more, but I definitely think for themselves, there's a lot of people who aren't likely to reach out purely because they don't want to burden other people or feel like they're burdening other people.
As they came out of lockdown, we saw the return of some of the more traditional issues. So things like bullying and actually suicidal behaviour kind of went down in lockdown. But as young people came out again, went back into their school environments, actually some of those traditional things returned, which was quite unusual.
You noticing people are talking more between friends about it?
I think so. I mean, I'm not sure if it's the same with everyone, but it's definitely something that we're all, you realise that everyone struggles.
Our research suggests that about a quarter of young people who were getting some form of mental health support in the run-up to the pandemic could no longer access it by the summer. And that was sometimes because those services just weren't available. It was sometimes issues with access to technology, or just not wanting to have a counselling session when your parents are next door. Our parents' helpline has been busier than ever. There's been a 43% increase in the number of parents we've been able to support.
I know that the redundancies are very scary for people of my age, and also, like Kat said, people of transitional ages, of kind of, can I get a job? Will I be able to keep that job if I get it? How long am I going to have it for? And I think that's very scary kind of going on from COVID and from lockdown.
In the notes that you sent previously, it said you had a 334% increase in people reading about searching for a job. So how do you all cater the organisations towards focusing on, the higher percentage of the requests that are coming in?
We've actually tried to increase the volume of materials which we have online for young people around their financial well-being. So we've done some work with My Bank and with the MAPS, the effectively the money advice service thing, to produce more content with them.
I wondered if there were any positives that you have taken from COVID.
One of the key things that we have learned is that partnership model, and working with others to make the impact that you have, so much bigger.
I agree with that. I think we've seen so much partnership working happening very, very quickly. I think our sector's done a really good job as to try to link together some of the breaks and the connections, and to try and leverage our services as much as we can for other people, whether it's be placing our service through our triage tool in other places, or building portals, or developing programs with other sector partners.
While it's been done out of necessity, we've all improved our online services so much in the last few months and been able to reach more people that way, which has been so positive. And it has been great working in partnership across the sector.
I'd also have a bit of a shout out for the young people. I think we've spoken a lot about the challenges which they're facing, but right from day one, we had young people coming forward off wanting to help, either in their local communities or to support their peers online. And that there's been a real wave of that, of young people wanting to get engaged. And I think we've got a bit of an opportunity here, because young people haven't really been heard in this discussion. And actually, there's a big force of people here who want to make a difference.
I'm going to hand back to Hugh in a second, but just really to say thank you from my perspective. That's been hugely insightful, and just really to echo Hugh's comments at the outset that, you know, we're very proud to be associated with the work you're doing. You know, it's phenomenal.
It's been a fascinating hour, and I'm just sad not to be able to see and to meet you all face to face. It really is admirable, the work you're doing. Again, just feel incredibly proud to be able to help. And also, it's highlighted to me the importance of the younger generation's voice actually being heard. I think that will go a hell of a long way. So hats off to all of you. I'm incredibly grateful to have the opportunity to speak to you, really. And I do hope we can get out the back of lockdown and the back of COVID with our heads held high, knowing that we've all done a good job looking back at this period of time. So many thanks.